My name is Anne-Claire. I work as a program director for ADRA. I'm based in Lebanon, and I have the opportunity to work on the Syria crisis and its impact on Syria and the neighboring countries. I came to this conference to share my experience of the conflict and the type of humanitarian assistance that INGOs can bring. I was very happy to be part of this panel, to be able to speak about the field, to speak about what we see in the field, especially to a student public, and I hope this helped them to better understand the situation there. ADRA is officially registered inside Syria and has decided to work in the government-controlled areas, but has not yet implemented any operations. We're also active in Lebanon, Jordan, and looking at Iraq as well. And this is what I would like to talk about this morning, as well as about an impression or my perspective on the crisis in Syria. Being based in Lebanon and working on the Syria crisis, I was lucky enough to be able to travel inside Syria, although I stayed in the capital city of Damascus only. I went to Kurdistan, Iraqi Kurdistan, I went to Jordan, and of course Lebanon. And it gives a very different perspective of what you may expect from a humanitarian crisis. As we mentioned, this is a complex crisis. This is all the more complex that Syria is not a poor country. It is not Ethiopia, it is not DRC, it is not Yemen where I used to work. It's a middle-income country, so the impact on people is different for that matter. It's like many of the people I met, many people who were affected, were like you and me. They were teachers, they were health workers, they were taxi drivers, they had groceries, and now their life has been disturbed by this conflict. Whereas they are still in Syria, or whereas they moved outside Syria towards Lebanon, Jordan, Iraq, or Turkey. What is striking also is that everybody is affected. You will think that those who are the poorest before the conflict will be the most affected, the most vulnerable. This is not always the case. I was doing field visits about 2 weeks ago in Lebanon, and we were visiting what we call tented settlements. These are people living in, let's call it big tents, made of plastic sheet, of wooden panels, of whatever they can find. And these people were from the countryside, from a government called Raqqa, which is in the northeast. And those people were actually doing okay in the sense that the life in Lebanon was not so much different from the life before in Syria. They were coming from the countryside, they were living simply, they were working in the fields in Syria, now they were working in the fields in Lebanon. Of course at a lower wage, of course they were facing issues, but the impact, the psychological impact on them was relatively lower compared to those from the cities, for example, who lost everything, who lost their businesses, who lost their houses, who lost relatives, and were going to either were displaced inside Syria or outside to Lebanon and Jordan, and were forced to do unskilled labor to be able to earn some income, to provide for rent, to provide for food, not sending kids to school because the curriculum is different or it costs money and they cannot afford to pay the registration fee or the supplies or the books for their kids. So this is something that I was very touched by the different impact of the crisis on actual people. Another thing also for us humanitarian workers that we need to take into account is that Syrian people or educated people, in the sense that we need to adjust our response to their needs. Again, if I compare with Yemen, where education rate is lower, you go to people and you tell them that they need to wash their hands to avoid transmission of disease such as diarrhea. In Syria, they know about it. This is not the point. But the point is that they used to, when a disease would come, to go to the health center. The health center, the health system in Syria was working well. The water system in Syria was working very well. But now this has collapsed. They don't have the infrastructure. So they don't have the new knowledge and the new habits to adjust to that situation. And this is something we need to take into account. When we talk to these people have knowledge. We need to respect that. We just need to work with them on how to adjust it to the new situation. Another characteristic of this crisis, as Marek mentioned earlier, this is a huge crisis, and this is not going to stop tomorrow. Even if the solution was found to the conflict, the consequences will be to be looked at for years at least. Syria was doing well on the economic side before the crisis. When I entered Syria, when I crossed the Syrian border on my way to Damascus, I would see all these buildings alongside the road. Big buildings, and I was told that these are resort hotels that were built in 2009-2010 with money from Gulf investors. And this is, of course, close, not working. This was just a symbol of everything is stuck economically in Syria. So this country will need huge assistance to be rebuilt, if it can be rebuilt, if the conflict stops. Another aspect of the crisis is the impact it has on the neighboring countries. We are talking about plus 2 million of refugees. This is the number provided by UNHCR, the UN Agency for Refugees. This is the number of registered refugees. There is also a number of unregistered refugees, whether they fear that the name will be used against them for whatever reason.